Hi, I'm Dr. Kenneth Fink. I'm a medical oncologist at Zimmer Cancer Center at New Hanover Regional Medical Center, Wilmington, North Carolina. Lung cancer therapy has come quite a long way in the last several years. The treatment has improved and survival is improving greatly. Some of the newer things going on include all aspects of lung cancer therapy, including the surgery of lung cancer, the radiation therapy of lung cancer, and the medical therapy of lung cancer. In particular, one of the newer innovations we've had in the last 10 years or so is what we have found. Since most patients with lung cancer, actually 75% of lung cancer patients cannot have surgery, it leaves us with, because their cancer is just a little bit too advanced and the surgeon can't remove it, it leaves us with the other treatments such as radiation and chemotherapy. One of the better innovations we've had in the last 10 years is the combination of chemotherapy and radiation. We have found that works quite a bit better. There was a time when if your lung cancer couldn't be removed, you would just have radiation alone. And then some good trials came along about 15 years ago that tried chemotherapy before radiation, and that seemed to improve their survival by quite a few months. Then some more trials came combining radiation therapy with chemotherapy, and that improved survival even more. Although it's a little bit more toxic to get the chemotherapy with radiation together, we found that overall patients do a lot better and get a lot longer survival. Once the lung cancer has spread beyond the lung and is now metastatic, patients are obviously very worried about their situation and whether they'll survive and how long they'll survive. What we have found is that some of our drugs have gotten much better in the last 10 years in this regard. The drugs, in fact, the drugs 10 or 15 years ago, we weren't even using drugs for that situation. We would have none that were available, or if they wanted to try experimental drugs, we would give them that try. By doing experimental protocols that way, we came out with much better drugs and much better outcomes. One of the newest treatments is a drug called bevacizumab, also called Avastin. When combined with standard chemotherapy drugs, this drug has been shown to improve survival. This is a very interesting drug. It's what we call a biological or an immunological drug. It actually targets the blood vessels that feed the cancer. And it sort of prunes the vessels down and allows the chemotherapy drugs to get into the cancer a lot better. And it also reduces the blood flow to the cancer so it doesn't survive as well. So that's one of our biggest innovations. So I would say that for lung cancer therapy, we've come quite a long way. We've improved survivals quite a bit with a combination of chemotherapy and radiation. We've come up with excellent new drugs, including biological drugs that attack the blood vessels and reduce the blood flow to the cancer and improve the chemotherapy into the cancer. And this has all resulted in an improvement in survival of lung cancer.